least, we move on to our fifth presenter, Dr. Piotr Marx. He's a licensed pharmacist, adjunct professor at the Faculty of Medicine, Collegium Medicum Cardinal Stefan Wisniewski University in Warsaw, Poland, CEO of Picturac Limited Company, funded by the National Center of Research Development in Poland and Black Pearls VC. He holds international expertise in various pharmacy sectors, including educational facilities, governmental and non-governmental bodies, pharmaceutical companies, hospitals, and community pharmacies. As an educator and innovator, Piotr works to empower pharmaceutical scientists and pharmacists as the future leaders in healthcare. He started his career as a registered pharmacist in the UK primary care setting, delivering public health interventions to patients in underserved communities across the UK. It was his early experience in practice that inspired him to conduct research in social pharmacy before moving into the academic sector full-time in 2011. He went on to earn his PhD in pharmaceutical care services and achieved his degree in 2017. Piotr launched the Polish pharmacy trade union ZZPF to support employees in the pharmacy sector. He is a recognized leader across the pharmacy profession and more widely in science, pharmaceutical technology, and innovation. He's also working closely with FIP on the development of pharmaceutical pictograms and Polish pharmacy sector as an advisor. His work, research, and leadership have been recognized internationally. Throughout his career, Piotr has acted as a passionate advocate for the pharmacy profession and has partnered with stakeholders across sectors to align the pharmacy workforce with the Sustainable Development Goals to make an embracing change for the pharmacy as a profession. Piotr, the floor is yours.
Thank you very much, everybody. Thank you very much for the invitation to FIP and also to our sponsors. So I would like to just tell you exactly how we've done it in Poland, because I think it's very interesting. If I could just ask for the next slide. Thank you very much. So the situation in Poland, if you could just move to the next slide, I will show a few diagrams, please. Currently the main motivator was the flu vaccination rates in Poland. As you can see, it's extremely bad, because we shifted from 3.66% to current situation is around slightly over 6%. And it was just shifted during the COVID-19 pandemic, when actually there was lots of campaigns that it's worth actually to have this both vaccinations together. Next slide, please. Another problem that we have basically is the limited number of healthcare workers. It includes obviously doctors, nurses, and also pharmacists. As you can see, as the data from the OECD, Poland is on the last place. So it means we're desperate to use any kind of resources. Obviously, pharmacies are the most important now to be used and take advantage of to provide basically services. During the COVID-19 pandemic, to just summarize in my research, only 11% of GP practices were open to deliver the standard services. The rest were tackled, basically 90% of people were tackled by the community pharmacist. Seeing in the first period of pandemic, I just would like to kindly remind that Poland is 38 million people. So we're tackling around 8 million a day. At the total of nearly 13,000 pharmacies in Poland. So it's a great amount. Average per day, it's around 2 million of people we are seeing every day. So it's a great potential, but unfortunately still not used properly. Next slide, please. What is about the market? Because I'll just make a short summary. So the population is around 39 million. We have around 16 million patients at risk of flu. And we have basically a strong recommendation from the Ministry of Health and the government, but unfortunately we have very low activation of the healthcare workers to provide the vaccines. Till basically the bill in 2019, basically 99% basically of they were expended from the private budget, so it means that patients were paying themselves. In 2018, that was a slightly shift in the trend, so 50% basically it was reimbursed to the group of people over 65. And in 2020, we observed a big move, because we have basically divided different sectors, and 2 to 5 years old children and adults, basically, they have 50% reimbursement, and all the citizens over 75, they are 100% reimbursed for the vaccine for the flu. And obviously, a few main players. We have Sanofi Pasteur, that is 67% on the market, Mylan, and since 2020 also AstraZeneca. About rates and vaccination rates. So influenza obviously was the first concept to be presented to the vaccines in Poland, but not yet in the pharmacies. We are still waiting for this legislation, but I will just make a sum up in the evening, in the end of the presentation. So we have 13% of elderly people over 65, but only 4% of them are vaccinated. So I believe this is really bad. As I said, COVID-19 slightly make aware people, and especially old seniors, citizens, about necessity of influenza vaccines, also about pneumonia, pneumococcal vaccines. But it's still the immunization rate is really low, what we are not very happy with. And obviously we have permanent shortages at the doctors and nurses, but also pharmacists. So we were thinking that maybe a small involving pharmacists in vaccines could make a small difference to help basically deliver this prophylactic services. And obviously, another problem that we have is the competencies of physicians, and that there's lots of needs to be done basically to activate them to provide the service, and it's not very popular, and they don't get much benefit from it. So obviously, nobody's really properly motivating the vaccination services. Next slide, please. Thank you. I'll just show you the way what we've done. So basically, all the projects started in 2018. All the organizations were actually practically involved in the project, including the chamber, but also the trade unions. In 2018, we designed the first project under supervision of the Pharmacists Without Borders from Canada. Also, we work closely with the English company ACG Group, who delivered the services in England in 2007 as a training. And we designed basically a workshop plus the pilot to deliver the training to the pharmacists. Around 770 pharmacists basically took part in the service. What is good, I mean, we expected that the flu would be the first service to be provided in the pharmacies. Unfortunately, it didn't happen. So the COVID was the first vaccine that we provided in the pharmacies. This is like what we've done, and obviously it was a long effort because it's all started in 2018, but we have now 2022 just in a moment. Currently, basically, all the COVID-19 pandemic was actually shifting lots of changes. First of all, we have pharmacists can prescribe prescriptions to the family up to the third generation back, all the drugs, excluding the control drugs. So it sort of gave us a big breath, because we could serve our families and provide drugs when GP practices were unavailable. And what is a great move, in my opinion, so since May 2021, we can basically provide COVID-19 vaccination plus additional we do qualification. First, we started in the national vaccination centers. Now, basically, just a month over, so around June, we started to do vaccines in the pharmacies. Next slide, please. So how we done it? Because I think this is the most important for this session to help you to make your own way in your own countries where you are still, the stakeholders where they are just still struggling to make a final decision. So the Polish drug policy was the most important thing. The EU recommendation, obviously working with the stakeholders like FIP, also the local experts. I just would like to tell you that every year we hold a conference about improving immunization rates in the area of the flu in Poland, and 2 years ago it was just impossible to convince the doctors and nurses. During the COVID-19, the system realized themselves that it's not capable to cope with this number of vaccination needed. So we created a coalition on pharmacy-based immunization, where my organization, which I represent, the trade union, also the pharmacy chamber of Poland, and also some few other organizations are participants. So basically, we have obviously lots of legal constraints on the way, especially the resistance from the doctors and nurses who are feeling like we are taking away the money and the jobs. So it's actually, the COVID-19 help us. So next slide, please. The legal changes. First of all, the one of the most important documents that actually turned up in 2020 was the Professional Act, where we actually designed this service as a vaccination service in the Professional Act. Also, some other services like medicine use review and some basic diagnostics were mentioned. Also, repeat dispensing was there on the list, so it helped a lot, which slightly adjusted the pharmaceutical law. And we sort of also created a kind of idea how it should be financed from National Health Fund. So the legal report was ready, the systematic report is done and delivered, and now what we do is just advocacy. Execution of the changes, because I think it's also very interesting. So here it's still ongoing. We are educating pharmacists. Now around 9,000 pharmacists are trained for provision of the COVID-19 vaccines. They are qualifying, plus they are performing vaccines. We created the standards. Actually, some of the standards, most of the standards were based on the 2019 pilot, which we delivered on actually flu, but it was just a university pilot, not really done with the government, but with the support of different organizations responsible for different stakeholders. So actually, it helped us a lot to assess the capability to deliver, but also it allowed us to assess the skills of pharmacists and resistance, because in the study the most important problem was the training. So after they've been trained, the motivation has changed. I would like to just kindly tell you that at the beginning of 2021, and only 37% of pharmacists declared that they will be happy to deliver vaccines. So it's not very satisfactory for me, but it's changed a lot after our second study, which we performed like recently. And now, obviously, what is the most important is that we are educating, and looking for the partners to make a coalition. Next slide, please. The milestones, because this is something that I should quickly tell you. So obviously the Pharmaceutical Act, that's the most important document for us to show the way. It's like a roadmap for pharmacists. Another one is amendments to the Act of Infectious Diseases, where we basically entitled pharmacists for the pre-vaccination COVID-19 exam plus the vaccination for COVID-19. Pharmaceutical care pilot, which is now hopefully to approach us shortly in October. We're going to perform the medicine use review project, and another few changes, establishing a vaccination in Poland in Q2 of 2021. Now, obviously, the implementation of the COVID-19 pilot, but the case was that we are planning to have a pilot, but finally it was without a pilot. So it was a massive rollout without a pilot, only based on the data that comes from other countries. And now, obviously, we are working to put on the list the influenza. Hopefully, the decision is going to be done any time now. We are just waiting for the final decisions, and hopefully soon from November we are going to start training against influenza. I think it's very beneficial due to the fact that patients are extremely satisfied with what we've done. And obviously, we are going to officially basically make a quota for reimbursement of this influenza services. So this is something that is happening obviously now, and some few other things we are planning obviously for 2020 and 2023. The opportunity that the vaccines can be prescribed by pharmacists, I think it's going to be a good idea, especially now that we are really prescribing a lot for families and up to third generation. So the numbers definitely make a difference. And the most important thing to tackle as well in Poland is lifting the ban on advertising in pharmacies. We cannot advertise, for instance, the surgery next to me where I'm just working in a pharmacy can advertise that they are performing vaccines. Unfortunately, me as a pharmacist, I can't. So basically, I'm losing. So this is something that definitely should be emphasized as an obstacle to provide vaccines. Next slide, please. The most important engagement into COVID-19 vaccines. First of all, pharmacists can vaccine alone, so I can do qualification plus I can do performing the vaccine. The pre-vaccination examination is really easy because it's a standardized questionnaire. We have 2 steps training based on the actually English requirements and English model, and we can just perform vaccination in the pharmacy. The fee for us is around 13 euros. As a trade union, we support the concept that it's 50-50 divided by the pharmacist and the pharmacy owner. What I think is a very good option for us to get some extra remuneration. And all the project is financed fully by the Ministry of Health, including obviously all the materials, needles, syringes, and dressing and plasters, all is basic in the package. Next slide, please. That's the map, how we perform. I believe it's not too bad because we started to do just before the vacations. So obviously there was not so many people interested, but currently around 829 pharmacies submitted to the National Vaccination Project against COVID. And very actively, there are 425 engaged pharmacists, 9,000 pharmacists trained, and currently we completed over 70,000 vaccinations against COVID. So I think this is a very good number for us. That's our country, and you can just see how it works. Next slide, please. And myself, I've just performed also a service satisfaction survey. So what I'm really proud of, that we monitor pharmacists performing the vaccination rates in the national vaccination centers that are established by the government, but also in the pharmacies. The percentage is more or less the same. So 94% of, nearly 95% finds that vaccination are done by pharmacists are extremely convenient. 93.5 believes that the pharmacists have skills to administer the vaccines. 90.8 declares that it should be also performed at the pharmacy when they're just preparing this questionnaire in the National Vaccination Center. 88.1 think that there should be other vaccinations, like for instance influenza or pneumonia, pneumococcal, sorry, and other vaccines. And so the work in progress, we are still collecting the data. Currently, it was 1,147 people who just decided to answer our question. Next slide, please. Also, we performed a kind of research at the beginning of the year, winter, at the end of the 2020 and 2021. 85% of the people basically screened agrees that with the statement that pharmacy are more accessible to the patient than GP practice, pardon me. 62% believes that vaccination in the pharmacy would be a quicker and a faster thing. Also, this is now a statement that most of the patients, they say 1 minute from home and I'm here. So this is excellent, and I think this is something that comes all the time. Also, whispering marketing, when they're happy with our service in the pharmacy, they come back and also they bring the families. And very often I'm also acting as an educator, and we are acting as an educator among pharmacists who are providing and to convince them that there's no chip, there's no artificial intelligence in the vaccine, there's nothing bad about it. It's basically a way to prevent your family and stay healthy for longer. The last basically 63% of people definitely they believe and they already experience that it's faster than going to the GP, because here you just step from the street and you are inside. You don't have to book an appointment and it's done straight away. So all these things basically, I think also like my other previous guests who were just speaking, research is the key, and it's a biggest weapon for me, because I have collected all the data about it to convince the stakeholder for further changes in the Polish vaccination system, which should hopefully include more and more vaccines and also be more important for the government. Next slide, please. So thank you very much for opportunity to speak, and I'm hoping you enjoyed this presentation.